Welcome to the Deep Dive. We're here to basically break down complex topics from a whole stack of sources, giving you the essential insights. Today, we're diving into something that affects, well, millions. Panic attacks. We've got a really solid report here on understanding and managing them, and we want to turn that info into something clear and useful for you.
Yeah, our goal today is really to demystify panic attacks, help you understand what makes them unique, how they're different from just general anxiety, what might trigger them, and crucially, what actually works in terms of solutions.
Okay, so let's start right there. We hear panic attack thrown around a lot, but what is it precisely? And how is it different from, just feeling super anxious?
Right, good question. So a panic attack, it's defined as a sudden blast of intense fear. And it triggers these really severe physical reactions, even when there's no actual danger around, no obvious reason for it.
So the body's reacting like there is danger.
Exactly. What's fascinating really is it's your body's own fight or flight system, the natural one, kicking in, but without a real threat. It's like an internal alarm screaming danger when maybe nothing's actually wrong.
Wow.
Yeah. And it often peaks really fast, within minutes. People describe it as an impending sense of doom. And the symptoms, they often feel terrifyingly like a heart attack.
And it's more common than people might think.
Surprisingly common. About 11% of people in the U.S. experience at least one a year. And interestingly, females seem to be twice as likely as males to experience them.
Okay, so that distinction you mentioned, sudden, acute versus general anxiety. Let's dig into that because people often say anxiety attack, but you're saying that's not quite the right term.
Exactly. Anxiety attack isn't really a formal diagnosis. General anxiety, that tends to build more gradually. It's often a persistent worry, maybe linked to a specific stressor, and it can last for days, weeks, even longer.
Right, like a constant hum of worry.
Yeah, sort of, but a panic attack, it's sudden, it's acute, it usually peaks within, say, 10 minutes, and might start fading after 5 or 20 minutes, though some can last longer. The intensity is just off the charts. That fight or flight response takes over completely.
Leading to those really intense feelings you mentioned earlier.
Intense fear of dying or losing control. It's very different from the kind of restless worry you get with general anxiety.
You mentioned that extreme fight or flight response. Can you describe that a bit more for someone listening who's maybe never felt that? What does it physically feel like?
Oh, it's rough. The symptoms are severe. Think pounding heart, feeling like you can't breathe or like you're choking, sweating, trembling, feeling dizzy, sometimes even nausea. It's like your whole body's just screaming, alarm!
That sounds overwhelming.
It is. And there's this feedback loop, which is really key. You feel the first physical symptoms, maybe your heart races, and your mind immediately jumps to the worst conclusion, I'm having a heart attack. That catastrophic thought then fuels more fear, which makes the physical symptoms even worse.
Which explains why people often end up in the ER.
Precisely. They think it's a medical emergency.
And that brings up a really important point. With symptoms like chest pain, how do you tell the difference between a panic attack and something like a heart attack? Because you wouldn't want to ignore a potential heart attack.
Absolutely not. It is medically crucial to rule out other conditions. Always. While panic attacks do often involve chest pain, a key thing doctors look for with a heart attack is pain that radiates maybe down the left arm, into the jaw, or the shoulder blades. But honestly, if there's any doubt at all, get medical help immediately. Don't guess.
Good advice. But the attack itself isn't the end of the story, is it? There's this lingering effect.
You're right. A huge part of the long-term impact comes from the fear of having another one, just worrying about it recurring.
The fear.
Exactly. That worry can persist for a month or more, and it leads to avoidance. People start avoiding situations or places where they fear an attack might happen. That's what defines panic disorder. And in severe cases, it can lead to agoraphobia, this fear of being in places where escape might be difficult or embarrassing.
So what's going on underneath? What does the research say about the underlying causes?
Well, it seems to be a mix of things. Biologically, there's evidence pointing to dysfunction in the amygdala, that's like the brain's fear center. Also, potential chemical imbalances in the brain, and definitely a strong genetic link. If it runs in your family, you might be more predisposed.
And psychologically.
Big life stressors, traumatic experiences, even just chronic ongoing stress, these can all be significant factors in triggering panic attacks.
Now, here's something interesting from the report. Certain lifestyle choices, things people might even do to cope with stress, can actually make panic worse.
Yes, that's a really important point. Things like smoking, too much caffeine, even alcohol or other substance misuse. While someone might reach for them, thinking they'll help calm nerves, they can actually destabilize your central nervous system.
Creating a vicious cycle.
Totally. The supposed solution actually fuels the problem. So avoiding or reducing those is pretty crucial for managing panic.
Okay, so let's talk practicalities. If you're listening and you feel an attack starting,
Yeah.
what can you do right there in that moment?
The key is to try and redirect your attention and regulate your body's response. Deep breathing, specifically diaphragmatic breathing, breathing deep into your belly, it can really help. It directly counters the hyperventilation that often happens.
I sense slow things down.
Right. And grounding techniques are great too, like the 5-4-3-2-1 method. You focus on finding 5 things you can see, 4 you can touch, 3 you can hear, 2 you can smell, 1 you can taste. It pulls your focus out of those scary internal thoughts and anchors you in the present moment.
Simple but sounds effective. What about looking longer term for recovery?
Long term, you really need a comprehensive approach. Psychotherapy is highly effective, especially CBT, cognitive behavioral therapy. That helps you identify and challenge those unhelpful, catastrophic thought patterns we talked about.
And exposure therapy.
Yes, exposure therapy is another powerful tool. It involves gradually and safely confronting the situations or physical sensations you fear, allowing your brain to learn that the feared outcome doesn't actually happen. Medications, like SSRIs, can also be helpful for managing symptoms by working on brain chemistry.
But it's not just about clinical treatments, right? Lifestyle plays a part too.
Absolutely foundational. Regular exercise, a balanced diet, making sure you get enough sleep, finding healthy ways to manage stress. All these things support your overall nervous system regulation.
And finally, the importance of not going through it alone.
Hugely important. Connecting with people you trust, friends, family provides support and validation. Resources like the 988 Suicide and Crisis Lifeline are there too, offering immediate help. And support groups can be invaluable. Sharing experiences with others who understand is incredibly powerful. It reduces that sense of isolation.
So wrapping this up, what's the key takeaway for you, our listener? I think understanding that panic attacks, while incredibly intense, are ultimately a manageable phenomenon.
Yeah.
And it's your own body's protection system going into overdrive that understanding can be really empowering, can it?
Definitely. And the path to recovery involves multiple angles, professional help, yes, but also consistent self-care, lifestyle changes, and building those strong support systems. It's fundamentally about retraining your brain and body's response, and crucially, breaking that cycle of fear and avoidance.
So maybe a final thought for you to consider. Knowing that our own minds and bodies can create these intense internal battles, seemingly out of nowhere, what deeper understanding might you seek for your own mental well-being? Or perhaps, how could you use this insight to better support someone you know who might be navigating a similar storm?